Hello, good afternoon, everyone. I am Tazi Kabara from Nigeria. I welcome everybody to this debate session under the program of Policy Advocacy on Genetics and Genomics, which is sponsored by Pan African PGS Education and Research Initiatives, PAPERI. This debate is part of the course in Policy Advocacy on Genetics and Genomics, and we are debating on this topic that should premarital genetic testing be a legal requirement. I and my colleague Ethel Bitel Chioma will be on affirmative sides of this topic. And good day, everyone, the panel of judges, the timekeepers, the coordinators, and the esteemed audience. I stand before you today on the affirmative sides to support the motion that says that premarital genetic testing should be a legal requirement for all intending couples before marriage. And as a way of introduction, we have to define what is a premarital genetic testing means so that the audience and everybody will understand what we mean by that, which refers to the medical screening carried out before marriage to determine whether individuals carry genes that may lead to inherited disorders in their children. And these disorders include conditions like sickle cell disease, thalassemia, cystic fibrosis, Huntington disease. And the most common of all, yes, as we all know, that sickle cell disease and thalassemias are one of the diseases that affects our society, and they are very, very common in Africans. In fact, we have the highest prevalence of sickle cell disease and thalassemias in Africa. In many countries, inherited genetic disorders continue to cause emotional suffering, financial hardships, and increased healthcare burden. And most of these conditions are lifelong, they are expensive to manage, and also they impose a significant burden on the quality of life of the individual affected. Our position is very clear that we are on the motion that premarital genetic testing should be a legal requirement because it's not intended to stop people from marrying. Instead, it is designed to provide couples with accurate medical information so they can make informed reproductive decisions and family planning. As all of us, we are advocates of public health. We believe prevention is far better. It's far, far, far better than cure. So government should implement laws requiring premarital genetic testing in order to reduce preventable hereditary diseases, and also um, will help us to protect future generations. So first of all, as I have mentioned earlier, these inherited genetic diseases are very, very common and highly prevalent in Africa. Because every year, thousands of children are born with severe inherited diseases that could have been prevented through proper screening and counseling. And let me begin with this simple, powerful truth that love is beautiful, but ignorance also is dangerous. So, families affected by these diseases, they experience emotional stress, social stigma, and heavy financial burdens. So, I stand to support that mandatory testing will help couples understand their genetic compatibility before marriage and enable them to make responsible reproductive decisions. And also, public health policies already require certain preventive measures such as vaccination, blood screening, and infectious diseases. So, also, we should look at premarital genetic testing in this direction as part of these public health policies to prevent society families, and individuals. So we therefore believe that making premarital genetic testing a legally required is a responsible, ethical, and beneficial public health intervention that go. Therefore, I want to start my arguments with the following points. The first point I want to start my argument with is that prevention of genetic disorders. Yes, one of the strongest reasons for mandatory premarital genetic testing is that it helps prevent severe inherited diseases. For example, when two carriers of sickle cell disease marry, there is a 25% chance that every pregnancy that a child with sickle cell disease will be born. And these children that are born with severe hereditary disorders, they require a lifelong treatment, repeated hospital admissions, and continuous medical support. So therefore, mandatory testing help couples identify this risk and make informed decisions regarding their marriage and reproduction. And secondly, my second point of this argument is that premarital genetic testing will help reduction in healthcare burden because these inherited diseases they create a major financial pressure on healthcare system. Governments tend to spend large amount of money treating these preventable genetic disorders. These expenses include medications, surgeries, blood transfusions, repeated hospital admissions, and long-term care. Looking at the nature of this condition, patients with sickle cell disease will require repeated admissions, multiple surgeries, multiple blood transfusions, and lifelong treatment. So imagine amount of money being funded to treat or combat these conditions. So preventing this disease through early screening is far more cost effective than lifelong treatment. If fewer children are born with severe hereditary conditions, healthcare system can allocate the resources to other important public health needs. So therefore, this testing benefits not only individuals but also society as a whole. My third point is genetic testing encourages informed decision making. As we all know, knowledge is power. Therefore, when we enrich our society with knowledge, we give them the power to make informed decisions about their lives. Premarital genetic testing empower couples with knowledge. Without testing, many couples enter marriage unaware of serious genetic risk. After having affected children, families may experience regret, guilt, or emotional trauma. So therefore, this testing allows couples to seek genetic counseling. They consider reproductive options, plan responsibility for the future, and they also understand the possible risk to their children. Therefore, knowledge is power, and people deserve access to important medical information before making a lifelong decision. My fourth point is premarital genetic testing also helps us to improve public awareness and genetic literacy. Through a mandatory genetic testing programs, people would understand the basics of genetics and also hereditary diseases. Because right now, many people are unaware of the carrier states or how inherited diseases are transmitted. Public screening programs help to create opportunities for health education, community awareness, early counseling, reduction in myth and stigma surrounding genetic disorders. Therefore, an informed society is better equipped to make responsible health decisions. The fifth point is that we have seen successful international countries where these policies were implemented and they were achieved effectively. For example, we have Saudi Arabia, where they introduced a mandatory premarital testing for hereditary blood disorders. Also, Cyprus, they successfully reduced thalassemia cases through national screening programs. Other countries have integrated genetic counseling into marriage preparation systems. So, this example shows that premarital genetic testing is practical, achievable, and effective. My opponents will argue that mandatory testing violates personal freedom. However, governments already implement laws to protect public health. Examples include mandatory vaccination programs, blood donor screening, and infectious disease reporting. So, genetic testing is similarly intended to protect future generations and reduce preventable suffering. Importantly, mandatory testing does not necessarily ban marriage. Instead, it ensures couples are informed about their genetic risk before making decisions. And also, some will argue that this genetic testing may cause stigma or discrimination. But this concern can be easily addressed through confidential handling of medical information, ethical genetic counseling, anti discrimination laws, and public education programs. The solution is not to avoid the testing, but to improve ethical implementation and privacy protection. And also, some may argue that this testing is too expensive. But in reality, prevention is far cheaper than a lifelong treatment. As we have seen the nature of this condition, they require repeated hospital admissions, repeated blood transfusions, and a lifelong medications. So, treating these severe disorders over many years costs significantly more than a single screening test. Therefore, mandatory testing is economically beneficial in the long term. Finally, I want to close by emphasizing and standing on my position that premarital genetic testing is not an attack on tradition or relationship. It's a bridge between science and responsibility. It prevents sufferings, protects families, promotes responsible parenting, and strengthens public health. The ultimate goal is not to control marriage choices, but to empower individuals with medical knowledge, reduce avoidable sufferings. A healthier future begins with prevention, education, and informed decision. Therefore, I strongly affirm that premarital genetic testing should be made a legal requirement. Thank you, everyone, for listening to this debate. And if you have any question, feel free to forward it. This, these are my references. Thank you.